I'm in Dhaka, Bangladesh, and I'm happy to have the opportunity to talk to you about how we're working here to improve the health of people living in slum communities through provision of clean water and latrines and hygiene education.
My name is Rabia. I am 40 years old. My parents and my 10 sisters and brothers moved here from the southern part of Bangladesh 20 years ago. My father could not find work in our rural village of Borashai, so we moved here.
Rabia lives in Demra slum. Demra is a squatter settlement outside the service area of the Dhaka public water utility. Therefore, residents of the community rely on extremely polluted water sources.
We have no choice but to collect water from the river. I know it is very dirty. Sometimes there are dead dogs and cattle floating in it, and also human feces. We get sick from this water. Sometimes people die from the water. At least we think it's the water. We don't know for sure because we are not educated, but the doctor says it's the water.
Bangladesh is one of the world's most densely populated countries, which puts a tremendous strain on available safe drinking water sources. Access to latrines is equally critical to controlling disease. Demra is home to about 100,000 people, most of whom do not have access to safe water sources, and they also don't have access to safe sanitation. These are a row of hanging latrines, which are called that because they deposit waste directly into open waterways. These waterways then flow to the community's drinking water sources. At Water1st, we believe that access to safe water is the most basic human right. Water and sanitation projects are essential for the health and dignity of poor people. Our support is provided in a unique way through our network of locally based and locally staffed partner organizations that each have a proven track record of implementing sustainable water projects.
We started working in Dhaka slums in mid-80s. We were a group of professionals and young people who wanted to do something. So we thought, okay, it is better to start with a healthcare project. In a sense, I'm a medical doctor, so we went out to the slums and started providing some treatment to people. One day, some people came to me appreciating what we were doing, but they flagged their problem of water with us, that we are living in slums and there is no water. We cannot access legal water supply.
When I travel to developing countries and I meet with the doctors that are working with impoverished people, they tell me time and time again that 80% of the illnesses they are seeing could be prevented if the population simply had access to safe water and latrines.